Now, kidney stones are nobody's friend. They are exceedingly painful and they are actually quite common. So, kidney stones, if left undiagnosed and untreated, can actually lead to some major complications like overwhelming infection or septic shock. So, the kidney stones can also lead to kidney failure. Yeah, they are a problem. So, the tricky thing about the kidney stone symptoms is that they can vary greatly from one person to another. They can be present in all kinds of different ways. So whether it's a blank pain or a blood in the urine or pain in your testicle, it is very important that you are able to recognize kidney stone symptoms. So let's talk about it. Today we are going to actually discuss about the painful truth about the kidney stone symptoms. There is like 8 warning signs like you should watch out for. So keep watching. Welcome back friends to another episode of the channel Wealthy Health. So we are actually going to talk about what a kidney stone is, and I'll give a brief overview of how a kidney stone is formed, and then I'll discuss why it's so important that you're able to recognize the symptoms of a kidney stone. And lastly, even I'll be talking about the painful truth about the kidney stone. So I'll give you 8 warning signs that you should watch out for. Well, it's exactly what it sounds like. It's a rock inside your kidneys. So the other name is for the kidney stone is nephrolithiasis. So the kidney stones are actually formed usually when you have a supersaturation of particles. So if you have like enough particles or substances floating around in your urine, they stick together and then stick inside of the kidney. Well, then they form a small type of crystals. So the other particles and substances flow by in the urine and then they stick to the crystal and then you form a kidney stone. Now there are actually different kinds of kidney stones. So like 80% of them are actually made of calcium, like usually calcium oxalate. So you can also have calcium like phosphate stones, struvite stones, uric acid stones, even cystine stones. They have different kinds and they can actually be present in different symptoms, and they can also have many complications. So the potential complications are why it's so important that you are able to recognize the symptoms of a kidney stones. So the complications can include like UTIs or the urinary tract infections. So you can get an overwhelming infection of the kidneys. And this can also lead to an overwhelming infection of the entire body, leading to a septic shock. So you can also get a blockage of a flow or obstruction that can lead to kidney failure. So the kidney stones can be very big and a very bad deal. So now let's get into the painful truth about the kidney stone. So what I am going to give you is like 8 warning signs like you should watch out for. So number 1 is pain. So pain is the most common symptom of kidney stones. So you can get pain in the back, the side, the flank, the groin. So the pain is due to the kidney stones and it is for a number of reasons. So one, it is due to the blockage. So if a kidney stone is large enough, it can actually cause a backup of urine in the kidney, which can lead to a stretching of the kidney, which is very painful. Also, you can get a renal colic, and this is a different kind of pain because it comes and goes. So it may come and really be strong like a 10 out of 10 and last for 20 minutes or an hour, and then it may release. And this is what's happening. So you have a certain movement in your kidneys and in the ureters like the peristalsis, and there is a contraction. Or it's like a wave, and when you have a wave that tightens, then it can tighten around the kidney stone or cause a pain. And so that's why people often describe waves of pain with the kidney stones. So the pain can be in the back of a flank, especially if the stone is higher up. And if the kidney stone is a little bit lower, and then it can radiate. So that the pain can radiate from the back all the way down to the groin area. And if the kidney stone is a little lower, like in the ureter, that tube that is between the kidneys and the bladder, well, you can actually get a pain in your testicles. Or if you're a lady, you can get pain in your labia, or the labia means the lip. So this is what happens. See, pain is not always just localized in the flank or on the side part. So that's where it's pretty common, or in the groin. You can also get just a diffuse abdominal pain. So you can get pain all over the abdomen with the kidney stones. Even pain can be treated with all the kind of pain medicines, like the Tylenol is one that is very popular. So always make sure that you consult with your physicians, or if you have a chronic kidney disease, you let the ER doctor know, because you may not be able to take the NSAID, that is the non-steroidal anti-inflammatory drug. But there are like different other pain medications that can work too. And of course, correcting the underlying problem, getting rid of the kidney stone, is going to be the absolute treatment. So the second one is the painful urination. So the first sign was the pain, the second one was the painful urinations. So now the pain when trying to urinate when you have a kidney stone can come to that of a kidney stone moving further down as the urine flows past. And if that kidney stone moves to a spot where it's tight and it starts scraping against the inner portions of your kidney, that can cause a pain. Also, as I mentioned, that wave, that peristalsis, that contraction in the kidneys and the ureters as the stone moves can also cause pain while urinating. So if you get a complication of urinary tract infection, then of course that can cause dysuria or the painful urination as well. So frequent urge to urinate. So the third sign is the frequent urge to urinate. So now if you have a kidney stone again and it's causing a blockage, then it can give you a sense of fullness in the kidney, or depending on where the stone is located, it can actually give you a sense of fullness in the ureter or in the bladder, and it can actually make you feel like you have to urinate. And then so you will run to the restroom quite frequently, but you get there and you really can't go. Oftentimes, like, because the stone is blocking the urine. So you may have a fullness, you have the urine that's there that really needs to go, that needs to get out and wants to get out, but you can have a blocking stone. So that can give you actually the urinary frequency. And again, if you actually do have a urinary tract infection, well, that also can cause the symptom of a frequent urge to urinate. So the fourth sign is blood in the urine, or the hematuria, what is called. So now you may not have the blood in the urine. You can also have a gross hematuria, which means it's blood that you can see with the naked eye, or you can have a microscopic hematuria, meaning that you can't see the blood. But when you go to the doctor and they test your urine, they're able to see the red blood cells there. So actually hematuria can occur with the kidney stones, most definitely the blood in the urine. So there's one study that shows that 10 to 30% of the cases of documented kidney stones did have blood in the urine. Even there's another study that revealed that 2 out of 3 people with stone down in the ureter had blood in the urine. So the tricky thing is that sometimes it depends on the timing, because there have been another study that shows that for the patients who presented on a day 1 of the symptoms, 95% had blood in the urine. But of patients who presented on day 3 or day 4, only 65 to 68% had urine. So it is variable. The blood in the urine is caused by the stones literally scraping and scratching the inside of your kidney. Okay, so they are literally scraping and scratching on the way as they move through the kidney, and this can lead to the blood in the urine. Like now, if you see blood in the urine, you definitely do want to consult with your physician. So now the way the blood looks in the urine can vary. It can be just a pink tinged urine, or an orange, or just little drops of blood, or you can get outright bright red blood in the urine too. So you can just be urinating out blood, and in that case you definitely want to consult with your physician or go to the ER even. And certainly if you have like symptoms of lightheadedness, or if you feel like your heart is having palpitations, this could be a sign that you're losing very significant blood. And again, you want to activate the EMS or call the 911 if you have this type of situations. Either way, you have to consult your physicians. And the number 5 sign is nausea and the vomiting. So now we know that nausea and vomiting can really be a kind of non-specific symptoms. But nausea and vomiting can be a presenting symptom or warning sign of a kidney stones. And it can be for a number of reasons. So it could be because the pain is so severe and it's causing you to feel the nauseated. And it can also be caused if you develop an overwhelming infection because of the kidney stones. So if you have the sepsis and this can cause you to be either nauseated or to vomit, the treatment will be again treating the underlying kidney stones. And certainly you can get like anti-emetics or the anti-nausea medicines, as well as medicines to control the pain and the antibiotics. And if you have an infection, if your nausea and vomiting are so severe that you cannot keep down the fluids, you definitely need to go in and see your doctor, because you likely will need the IV hydrations. So being dehydrated will put you at even more higher risk at the kidney stones. Plus, if you're like nauseated and having vomiting, you're not going to be able to keep down any pain medicines, and it could just be a miserable situation. The sixth sign or the symptom of a kidney stone is fever and chills. So if you had this like kidney stone and it has caused a blockage or a backup of urine in your kidney, you can certainly get a urinary tract infection. And the urinary tract infection may start off being in the kidney or even in the bladder. But then it can actually lead to a sepsis or an overwhelming infection that can make you very sick and give you fever and chills. So if you have an infection in the kidneys that can cause a fever and chills as well, you definitely want to go in and see your doctor. Even you need to have your urine tested and you need to have your blood tested for an infection as well. So they can treat you depending on what they find with antibiotics, with fluids, with pain management, and even with nausea medicines if necessary. Okay, now the seventh sign or the symptom is the cloudy or the foul smelling urine. See, now you will know that this is a problem, because the urine can be cloudy if you have a kidney stone for a couple of reasons. So one, if you're actually passing like bits of the kidney stones, or if you're passing something like gravel in the urine, the presence of the stones can actually cause the urine to look like cloudy. So, but if you have a foul smelling urine, then you likely have developed the complication of a urinary tract infection. And the eighth sign is the difficulty passing the urine, or just the inability for the time to pass at all. So now this is a problem, because this is an emergency. Like if you're having difficulty passing your urine, then it likely means that the kidney stone has caused an obstruction, a blockage. And if you have a blockage in your kidneys to the point where you can't pass urine, this can definitely lead to a backup of urine that causes a pressure inside of kidneys. And this further actually leads to kidney failure, and it can even lead to kidney failure very quickly. So if you're not able to pass the urine, you likely have obstruction or blockage, and you need to go to the emergency room. So they will evaluate you there, and they'll do imaging, and they'll do all the things to check you out for the kidney stones. So most importantly, they can actually relieve the obstructions, they can relieve the blockage. So it may be as simple as them placing a Foley catheter or a urine catheter too. Like, if they can bypass where a stone is, or you may need to consult with a urologist who may need to put a scope in you. So, or a cystoscopy, where they take a camera and a light, and they then go and they look and they see, it's a stone in the ureter, if there is a stone in the ureter. So is the stone a little bit higher up? Is it a bladder stone? And they are actually able to retrieve the stone and remove it. So that way, if that's not enough to remove the stone, there are other procedures like lithotripsy, where the urologist can actually use shock waves to break up the stone. And if it's like even more complicated than that, like for example, if you have one of these large struvite stones, the magnesium ammonium phosphate stones, they may actually have to do an open procedures. Though they can often do it like laparoscopically, but a urology consult would be in order if you have an obstruction that a Foley catheter can't relieve. So it is always important. So you have to detect kidney stones earlier to be sure that you try to avoid some of these complications like obstructions, sepsis, kidney failure, kidney. So kidney stones in like many cases can actually be prevented. So if you're someone who's already had a kidney stone, and there's like great chance that you will have another kidney stone unless you prevent it. And you can prevent it by drinking a lot of water, and by actually having your urine analyzed to find out what substance or particles are actually causing your kidney stones. The gold standard for diagnosing kidney stones is a CT scan with a low radiation and no contrast. And even kidney ultrasounds and radiography can also be used as well when it is needed, so especially like in pregnant ladies. So if you found this video to be helpful and very informative, please be sure to like it and to share it with all the people you care about. And I thank you for watching. So till I come up with a new video, I wish everyone a very good healthy life. So please take care and bye bye.